A nagging back pain was something Seymour DeRoche was trying to ignore. But after it caused a fall that landed him in the hospital, his doctors needed to take a closer look.
More tests and this and that, and they determined that it was a lymphoma type cancer that I had, but it had got rid in the spine, and it had damaged a lot of nerves, and it had paralyzed me. So I couldn't walk for 8 months.
Seymour was able to get the tumor removed from his spine, but he was still left paralyzed due to the pressure. Initially, his doctors didn't see much chance of a recovery.
The first couple of weeks, it was rough because, well, I was pretty well totally paralyzed. I couldn't get up, go to the washroom, nothing. I remember telling the wife one day, this is how it's got to be, I don't want to live this way, you know. So, then once Dr. Harrison come and examined me, and he'd seen a little hope, like he said, you know, send me down to the rehab ward. And one thing led to another from there.
Seymour came to us after he had surgery in Moncton for a spinal tumor, and at that point he really couldn't use his legs, so he was wheelchair dependent. So we had to teach him how to mobilize from a wheelchair, and then hopefully we were hoping that his legs would come back, so eventually he would be able to walk. But he was really quite limited in what he could do, so he really struggled, but he worked very hard.
The work in rehab was hard, but eventually Seymour's determination paid off, and he started on the road to recovery.
Come on in here, Shirley. He said, I'm starting to walk. So from then on, we started with the walker, and then it was outside on the step, walking a few steps, and then it took off from there. We're very happy.
Well, you know, we know that when there's sort of that perfect storm where you have a great patient with a great family support, and then also having a team, and that approach that he was able to use. So all those things came together, which really made it a wonderful experience to work with Seymour and see how much recovery he got. But he did have the right frame of mind, which is really important. And then we had all the resources in place to help him as well. So I think all those things added up to his great recovery.
I can walk, but it's still not a long way from 100%. It's sore, legs are sore if I overwalk. Walk some is better than not walking at all. I found out, you know, both ways, like, that's for sure.
As far as Seymour's concerned, his ongoing recovery is a credit to the doctors and staff at the QEH.
Well, the care is, can't say one bad word about any nurse or doctors or rehab, Bonnie, of course. What can I say, like, you know, even the food people that bring the dinner and that, suppers and that. A good care. I can't say a bad word about Queen Elizabeth Hospital. The nurses were excellent. Of course, when you're in Unit 7, that's a little different maybe than the other units. It almost becomes a family, you eat together and everything, and, you know. So it's very special like that, you know. I still think of them a lot.